We can start. Like I said, I'm recording all this, so that way, if anyone misses anything, they can always rewatch it. And there's a lot to cover just because I want to show some cool features of PolicyMap. All right. Okay, so yeah, so one of the things that you probably heard about the tool a little bit is that we are in this very large upgrade to PolicyMap, and really the upgrade is about technology, but also that allows the upgrade to include some really unique customizations of the data itself. So I'm going to take today's session and talk about how to use the PolicyMap tool in the new version, just for the mapping and customization part, but we're going to come back to the regular part of PolicyMap to show you some of the more the big features of the tool itself. And so the link at the very top here is what we call the beta link, and this will flip you to the new version of PolicyMap. As you can see, the interface is the same. The only thing that's really going to be a bit different for you is the technology underneath of it and some of the really cool things you can do with that new technology. So this part right here is just going to talk about the map, the data, a bit of customization, and we're going to flip back to the legacy we call version of PolicyMap to show you probably some of the more custom features that you probably work with generally. So the map tool itself is pretty simple. The two search bars in the very top are really simple. The map itself is fully interactive. So as you can see, you can zoom in and out. You can zoom using the little bar on the right-hand side. You can scroll with your mouse wheel. Pretty basic stuff. The right location search is a geography search. So think of it as a Google search bar. You can type in an address. It'll zoom to the address, it'll drop a pin on that location, and then from there you can still, zoom out to get a broader picture of the area that you're in, zoom in to get down to the street level if you need to, but also pan to different parts of the neighborhoods itself. So pretty basic stuff. But the search bar is also a geography search, meaning that if you don't have an address, you probably have a zip code or a city or a county. In this case, we can probably go into Missoula, and this will take you to the city, and then from the city itself, what you'll see is actually pretty cool. In this case, this is the very crazy incorporated boundary of the city of Missoula, and give you a little bit of context of the area that you're in. So the search bar is really kind of that basic function, is a geography search, and the goal of that really is to get you to the place that you're working in, and the next step is to be able to add data on top. You can also search for other geographies though, so things like census tracts, block groups, and such, but you can also search for complex geographies, which includes this drop-down menu here, things like congressional districts, school districts, metros, and such. You can also, though, overlay boundaries on top of the map. So instead of having to type in one city at a time or one zip code at a time or so, the boundaries menu on the left here allows you to do just that. That way you can just say, I want to show what zip codes look like on the map. And the map will basically show you the cool zip codes. One of the things you probably see if you are familiar with the tool before is that the new version allows you to have a little bit of a mouse over, but also a bit of customization, allowing you to remove the labels, change the line types, as well as the weight, and even changing the color of the boundaries itself. And this comes into play when you are looking at multiple boundaries. If you want to find out how census tracts sit within a congressional district, or block groups sit within a tract, or even tracts that sit within a zip code sometimes. And then finally, the really important part about boundaries is that sometimes you need to make your own boundaries on top of the map. And those boundaries is either a combination of roads that you need to draw and basically create a containment of that area, or many times you are trying to group together other geographies to build that boundary around. So that function, we call those things custom regions, and they're available in the top right. If we go back to the old PolicyMap, you'll see it's on the bottom, but the same interface here. There's 3 ways to make a custom region in PolicyMap still. The first feature is that draw feature. So this is a really cool feature because it is the free-form function of drawing on top of the map, meaning you can, this version here, which is the click to point, allows you to click onto the map. It drops a pin for that location, and then from there you just click onto additional points. You can zoom in to get down to the street level. This is a much easier one for me. And I always try to draw really complex boundaries, of course, and it backfires way too often. But click onto the final point, and it will close the area that you just created. So a drawn custom region is really unique. You can actually do multiple boundaries at the same time. So that way, the other draw feature is the pencil, which is the drag function. So this allows you to say, I want to start from here. I'm going to drag the boundary through this location, and we can go all the way through the airport and such. So a drawn custom region, either by click or by drag, both functions are the same. And then when you click on the save and close, this allows you to give it a custom name. So a drawn custom region is really unique within PolicyMap because it doesn't care about any of the underlying boundaries that we use within PolicyMap, meaning that you can cross block groups, census tracts, zip codes, counties, and such when you draw a custom region. It will care about those boundaries when you want to get aggregation for it. Maybe you want to get a report for it or download data for it. It'll use a really simple 50% coverage rule, meaning that if I were to put census tracts back on the map, most of the tracts that we see here, with the exception of this one, probably this one right here, will be used for aggregation within our drawn custom regions, even this crazy one right here. So that's kind of the basics of how our boundaries work in the case of containment when it comes to trying to aggregate data within that place. That does mean that sometimes you need to make a custom region of census tracts because you don't have the luxury of being able to draw something. So that other function then is what we call the assemble custom region. And that allows you to basically take boundaries that are in our universe and create a new one out of it in that process. So a lot of times you can use this to use census tracts to assemble new boundaries by clicking onto the map. But you can also use any of the underlying boundaries that are in our universe. So you can be very granular and use block groups instead, or be very general and use larger places like zip codes and counties and such if you're looking to make a new region that you're trying to aggregate data for in that process. But if you make a mistake, you can deselect areas at any time and then click on to continue to save this particular area. So we have a drawn custom region, we have an assembled custom region. Understand that custom regions in PolicyMap have a little bit of customization behind them too. So they're not just boundaries that gives you the ability to visualize the area that you're in. They also have a little bit of intelligence behind them as well. And they are available in these little icons along the edge. And from that, when you expand it, you can do one of the cool features that are in the new version of PolicyMap, which is you can edit custom regions that you created, as well as edit custom regions you previously created. So this allows you to reopen the edit function. And in the case of the assemble, you can re-edit boundaries for your custom region. But more importantly, you have a little bit of just general customization of the boundaries itself, changing the colors, transparency, or even just making a border of the data. And then one of the really unique functions of a custom region, though, is that you can take it to other features of PolicyMap. And one of the really cool features is the ability to take it right to the reports page. You can download data on the main version of PolicyMap. This is coming soon for this version here. But you can download data just for your custom region if you wanted to. And then probably one of the coolest features is the ability to share a custom region that you create with another user's account, meaning that if you are building boundaries for everyone that's working in a particular area, you can populate these custom regions within their account so they don't have to redraw anything on their side. And then with the new version of PolicyMap, they can edit that custom region if they need to in that process. But
Can I ask a question?
Yeah, please.
So some of the folks on the call have already generated custom regions that are neighborhoods.
Mm-hmm.
So they already exist. Will they be able to share those with other users?
Yes, yeah. So when you create a custom region, it will always be available in this menu here, which is my viewed custom regions. So if you create it here, you can still share that custom regions with other users, and then you can even edit that custom region currently or even as you share it with the new version of PolicyMap as well.
Oh, awesome. Thank you.
Yeah. And then one of the really cool features of custom regions though is that not only are you trying to define an area that you're working in, but we wanted to make them much more usable in that process because you want to be able to get data for those areas. And the reports is probably one of the coolest ways to get data for a custom region because it's going to aggregate the data within that boundary. So you can take it right to the community profile report. This is really what we call a bit of a demographic report. So this will have population, age, income, and so forth. There are some other really cool reports that might be of interest. The health report, I think your team have used here and there. Just understand the health report is by only 2 geographies at this time, which is census tracts and counties. So if you're looking to combine multiple geographies or get an aggregation of multiple tracts, counties, and such, it doesn't work at that time. But if you are looking to get a really comprehensive health report for a county or a tract, this is a really cool report to utilize that. But for now, we'll use the custom regions or the community profiles. You can see what's in that data. So the community profile for us, we actually built this as a CDFI ourselves, and we sometimes call this a snapshot of life in a given area. And the goal of this report for our lenders was to be able to get a really quick picture of the place that we're trying to focus in. And so what this is going to do is initially give you the geographies that's going to be aggregated for, the places that it touches, the general geographies that it represents, so things like what school district it touches, congressional members, legislative members, and then the data itself. So this is an aggregation of 4 census tracts in this case, and it's telling us that in 2000, that was the total population of 16,000, whereas 2018 was not much of a change. And then we're processing the ACS right now, so we should have that up fairly soon, probably by the middle of next week or so. And then you always have a percent change calculations based on the data itself, and then a comparison to the place that it's in. And so as you get further into the report, you're going to see things like the racial characteristics of the aggregation of those 4 census tracts. So it's predominantly white, but then there's mixtures of other racial characteristics within that area. The age group, the income ranges. So it's a pretty diverse middle and low income area that you're looking at, and then the comparison to the county and the state that it sits in. As you get further and further, you start leaving the section that really talks about the community of the persons, and it'll start talking about the community of the place that they're in. So things like housing types. So there's actually a large population of large small unit apartments in this particular area. But then things like tenures, home ownerships, vacancy information, job types, and unemployment and such. So this is a really neat report because, again, what it's trying to do here is basically aggregate the containment of that very unique drawn boundary that you created. And if you were to assemble by zip codes or tracts, it'll use that same concept and use just the geography that you assembled by to create this report. Okay, so that's really all I have for the new version of PolicyMap. There's some really cool things that we're adding at this moment, but understand that we're having a really big launch to the tool itself. And so that's the basics of boundaries itself. I'm going to talk about data while we're still here, but if there's any other questions about what you've seen, let me know. Hey, Lisa. Oh, I don't know if you're muted. You're unmuted, but not muted. Okay. So let's add some data onto the map, and then from there we'll continue this session a little bit. Once you have your map situated to a place that you're trying to work in, the next step really is what you're trying to use PolicyMap for, and that's adding data to the map. And that data is available in these categories above the map then. And the categories that we've created here, really the goal of them is to try to capture the grouping of data that it might contain itself in. So demographics will have things like population, racial characteristics, age, income, housing information like family types, household types, and such. Income and spending are variables related to income. Household income is the most commonly used income measurement, so the census breaks out things like head of households, type of incomes, income brackets. There are some very specific ways to look at income, and we'll dig into this a little further. So the categories, again, the goal is to put them into a place that hopefully you'll be able to find the data you're looking for. But sometimes you just want to get to data. Sometimes it's a little more difficult to dig through some of these categories because they're very comprehensive, and there's a lot of very specific ways the data gets to places. And so the other search bar on the left is a data search. So this allows you to use keywords that you're trying to find data for. So if you're looking for something like maybe adults with COPD, this allows you to type in a handful of letters or keywords, and this will pull up. Oh, I think we have Lisa.
Am I here?
You're here now.
Can you hear me?
Yes.
Okay, cool. Sorry about that. I was having audio difficulties. So, but I'm here. Thank you for hosting us, Phil. I appreciate it.
Yeah, no problem. I was telling everyone that I'm starting the session in the new version of PolicyMap because we're going to flip this fairly quickly. But the benefit is that the interface really isn't changed that much. The cool thing you're going to see is some of these really unique features that we talked about. Things like the unique customizations for custom regions, and then once we start adding data, you're going to see some cool features.
Awesome, but we don't have this yet, right?
Yep.
This is we do.
Yep. Yeah, everybody, anyone can get to it with the link in the very top up here.
Okay, super. Yep. Thank you.
Yeah, no problem. All right, so again, adding data, you can go through the categories themselves, but I am a big fan of the search bar because sometimes I just don't have the patience to figure out where COPD is in this case. So adding data, let's say we want to look for adults with asthma, same situation. You do have what we call the breadcrumbs in this menu here, telling you that if you go to the health category, which is over here, and under health conditions, chronic conditions, you'll find this particular indicator. So once you add data to the map, you're going to see a couple of different things. There are two types of data that you can interact with within the tool. Data layers is what we have here, and a data layer is basically data that's aggregated to a geography. It does mean that there's no address level data associated to layer data. It's just a summary to a geography. So the legend for layers is very helpful. But you can see that one of the new features is the ability to mouse over places to get you the value of those places. The other really unique feature of the new PolicyMap is you can click onto a place. It'll still give you the value of the place that you're looking at, but it'll also give you the benchmark of the geographies that it sits in as well. The legend, though, will give you all the tools to be able to read the map and the data that's on the map. So the first thing you'll see is just the simple sentence, the title of the data. So this is the percentage of adults that were reported to have asthma in the most recent Bursis data set. The icon here, the eye icon, will give you a longer data description. This is very helpful if you're adding data to the map that you are unfamiliar with, and maybe you want to learn more information about that place. So this is actually a very helpful description to understand where this particular data set regarding adults with asthma comes from. It talks about the survey, which is the Bursis survey, one of my favorite acronyms, which stands for the Behavioral Risk Factor Surveillance Survey. If you want to go deeper into the rabbit hole of data in PolicyMap, you can click onto the See Data Directory link here, or in the legend for any data you have on the map. This will take you to our data library page. This is a very helpful page if you just want to learn more about why this indicator looks like this on PolicyMap or how we got it into PolicyMap. So again, in the case of Bursis, it is one of my favorite data sets, and this has the variables we pull from that data set, the geographies, the source files, and then the description allows us to talk about some of the suppression rules and a little bit of the methodology that was done for some data sets within the tool. Otherwise, the legend is your tool that's going to be able to read the map itself. So there's two really important fields to look at when it comes to looking at a data layer. The first is the geography, which is a shade by. So this is telling you anything that's colored on the map represents a census tract. The 2010 after track isn't the year of the data. That's actually 2018. So this is the year that the tracks themselves were produced from the census. So we'll have the 2020 census boundaries fairly soon next year. And then, of course, the values of the colors itself. So there's really only two colors that were kind of in as we were looking at a much more rural area. But if we zoom out a little bit, we should recreate this into zip codes, and then we'll have some more zip code level data. The legend is also your ability to customize the data that's on the map itself. You can change a handful of things, and we're going to flip this because, unfortunately, BRFSIS data is only available 1 year for this type of aggregation. So I'm going to do a really simple layer like income for us. So again, title changes. Now we have to the estimated household income. The source link will tell us it's from the census, and then the customization allows you to do some really cool things. You can change the year, allowing you to go back in time. If you wanted to find out what income was in 2000, the map flips. Now we're looking at county level in 2000 because I don't think we had zip code at that time. So that we zoom in a little bit, we'll have census tract level data for income. The variable is changing how the data itself is presented. So in the case of income data, the default variable is dollar amounts because you want to see income as dollars. But this allows you to see that you can actually see income as percent change calculations based on the years available from the census. So you can see an 18-year change, or you can see a very shorter 5-year change calculation. So the legend changes a little more. Now you see that the colors represent on the map. Anything in a dark purple is still a census tract, but it's an increase of 28% or more, whereas the dark orange is a decrease of 0.3 or 0.8% or less. And then finally, probably one of the most unique ways to customize data on the map is the ability to edit the ranges themselves. So the first thing you can see on the new version of PolicyMap is you can isolate ranges on the map by clicking onto the values here and giving you a chance to add multiple ranges, which is a really cool way to present data to somebody, because you can say, here's just a handful of tracks that we want for you to look at in this process. But the other...
Hey, Phil, Lisa, I have a question.
Sure.
Sorry to interrupt you. So in our community, like if we create reports around this, we don't go to the table and say, oh, in this census area, we define populations by neighborhood, because that's what the city county government does, right?
Mm-hmm.
So could we do all this work if we uploaded the custom regions of the neighborhoods and do exactly what you're doing right now?
Yes.
Will that populate?
Yep, that's right. So we were just talking about that. So if once you create a custom region, then yes, you can isolate the data just with the custom region, which is a really cool feature in the tool.
Thank you.
Yeah, great question. So it is. Oh, go ahead.
Jim and Lisa, we learned also that you can share those custom regions that you set up.
Yes.
I know that was a question we had previously, so that you could share them with like PHC's account, and then I can use those the neighborhood regions for our work, which is super cool.
Yep.
Cool. So then I can just share it with our whole Missoula PolicyMap team, the neighborhoods.
You got it. Yep.
That would be so awesome.
Okay. I will try to figure out how to do that.
Well, if you want, we also do a mass update on the back end. So if you have a whole list of custom regions, and then I can generate a list that you have in your account, and you can identify which ones you want to share and who you want to share it with, and we can merge that over.
You can help me do that.
Oh, yeah.
Okay. Let's do that. That'll be an action item for sure.
Great. Yeah, and then probably one of the really important parts about custom regions that's new to the tool is that you can edit those custom regions. So one of the limitations of the current version of PolicyMap is that once you make a custom region, you're kind of stuck with it until you make a new one, basically. But with this version, you're able to edit that custom region, which is very cool in that process. All right, so the last thing about the legend when it comes to customizing data is that you can control the ranges or the value of the ranges itself. So besides being able to isolate the ranges in the map, you have the ability to make your own cut points of the values here. So to do that, you're going to click onto the range still. So the same thing you saw from the original version of PolicyMap. The difference here is that you get this very informative histogram of the data itself. And what this is trying to show you is that majority of the income data that's in PolicyMap, and really in the census, is areas that have middle income. So what it's saying is that there aren't too many census tracts that have incomes above probably about 100,000, I think is this range up here. Yeah. So everything really is within this like middle income. And that's really where quintiles are created. So we take the total number of geographies, which is tracts, and groups them together by density of data in those ranges. And so the quintiles are very unique. It does give you sometimes a very clear map that shows distinction of income ranges in this case. But sometimes you need to make your own ranges because you want to identify places specifically for users to interact with. So a couple of things you can do in this, you can change how many ranges. This is very helpful if you're just trying to show a very specific yes and no value of range of income. So this is 2 colors, and each color represents either above 56,000 or below, and so forth. Or more importantly, you can make your own custom ranges. And this is very important because this allows you to focus your readers to very specific places without them having to overanalyze a legend that you're trying to present. So let's say we want to find places that have extremely low income or very specific income. So I think 30-something thousand is what is in Missoula. So we'll do 35,000 in this case. So there's just one place that meets that criteria. And then from this, we can control these ranges to other variables you want. So you can go up to maybe 45,000 and then really bring this up to a different range that you're looking for. So maybe 65. And so the ability to edit ranges, as you can see, is very powerful because it allows your readers to look at a map and not have to guess too much of the color and the values. They can simply understand that the lightest color right here is this below 35,000, and the darker color is that above 65,000 in that range itself. Probably one of the most unique ways to customize data is the legend for a data layer itself.
I think that's really interesting, and I would wonder how we as a team could interpret like a definition around AMI, because a lot of work in our community with housing, for example, is done with thresholds of income with AMI, but interpreting what that number is and looking at those specific population has me curious to what that looks like.
Sure. Well, the good news is we have AMI calculations already. So
yeah, even better.
so you can actually look at just the actual AMI itself, but then we do the low mod calculations. I think that's what you generally work at, which is that percentage of household income versus the metro or the state that it's in. So we have AMI or low mod calculations for programs. So things like new markets, opportunity zones, qualified census tracts, all those are specific calculations that the federal agencies produce. And generally those low mod calculations are from the, unfortunately, 2015 ACS. We hopefully one day they'll use current year estimates for low mod calculations, which is actually what we created in this category here for income and spending. So this low mod calculation is based on current year ACS calculations. And so this is a neat way to see how the current low mod calculations are versus if you wanted to look at the federal programs that you're working on for things like qualified census tracts and such. So this range here you see, so places that are below 30% is in the light purple. You can isolate that. Oops. Which is just this one place here, but you can also show places that have above 120% AMI. And I believe we have the actual HUD data itself. That's going to be under income. Yep, there we go. So these are the default values from HUD for AMI itself.
That's super cool. Thank you.
Yeah, definitely. And again, another one of these cool features is use that search, because if you were to type in AMI, it'll show you the numbers for AMI, but we all use this crazy term of low mod, which I learned myself, as you can type in low mod and it'll tell you the different ways to look at low mod based on the different programs. And this, use the breadcrumbs here to see where these low mod calculations come from. So you can see some are from the CDBG program, some are straight from the ACS data, and then some are from other eligibility programs like the IRS and such. Yeah. All right, let's talk about one last type of data, which is points. And then from this, I'm going to take us back to the other part of PolicyMap, and we'll talk about some other pretty advanced features within the tool. And one of them I'm excited to show you then. So point data sets are really simple. I'm going to add a really easy one like hospital locations. Let me should have a few of these. There we go. We can zoom out a little bit. So point data sets are pretty simple as well. As you can see, what you have here, one of the cool things about the new version of point data sets is that you have much more control of the icons itself. So if you used the tool before, I know Robin has, you probably have faced the challenges of our default icons all being orange and having no ways to distinct the differences of what icons are being shown on the map. So understand that we've addressed that with the new version of PolicyMap, allowing you to change the size, the color, and even the shapes of the icons, which is super helpful when you are overlaying multiple point data sets. The other neat part about points is that point data sets are just that. They are icons of the map that represents the address for that particular data set. So in this case, these are hospital locations. The source link is telling you this comes from HRSA. And again, clicking onto the link for this will take you to the data directory for HRSA in that process. Each point location has a ton of information about that location. So this is the community medical center. It's a short-term facilities. This is the staffing information for this particular location. This is St. Patrick's, and so forth. So what we wanted to do is turn these pieces of data within a point data sets into what we call a filter, because initially, when you add a point data set on the map, what you're getting is, 100% of the data for the points themselves. And just change this a little bit. And what the filters allows you to do is basically whittle down the points that are being shown on the map, meaning that if I were to say I want to show just short-term facilities on the map will only show hospitals that are considered short-term facilities under that entry for filters. And you can combine multiple filters together. So if you want to find out places that are long-term and short-term at the same time, this allows you to show those two categories, and you can even take that even further and color code them by the one value itself. Filters can also be cross-tab, meaning that if I were to go back and say I want to show short-term and places that have over 1,000 beds, it's not going to be too many places, unfortunately. It's the deficiency of short-term hospitals. Oh, it's right in the middle. So you can start adding these, as you can see. So that's the really neat thing about filters, that you can either show one very specific range or a grouping of those ranges together in that process. And that's the benefits of filters itself, is that you're not just stuck with one filter at a time, but you can combine filters together until you're finding the correct matches of points. Okay, so that is a point data set, and that's really the bulk of what we're going to cover about on the new version of PolicyMap. As you can see, it's the exact same interface that you probably are working with if you've seen as we go back to the legacy, but our goal is that we're adding some new features to the tool, and there are some things that are currently missing with the new version. More importantly, things like printing and saving, which are being added right now. So it'll be there eventually in a couple weeks or so.
Hey, Phil, can I ask a question about the filters?
Sure, of course.
That's using OR logic, right? Not AND logic?
That's correct.
That's correct.
I'm sorry, it's an AND logic.
It's an AND logic. So, okay, but when you, so that, because you were selecting like the number of beds, and so you can't have multiple of those categories existing at the same time.
Oh, I apologize. Yes. So outside of the categories is an AND function. So this is only short.
Right. And so then if you add, okay, but within each category, so when you had selected short-term and long-term, that's
function. Yes.
That's OR. But when you add from the different, like from the different filter options, then that's AND.
That's
right.
correct.
Got it. Okay. Got it. Thank you.
It's a really good question about points. And then the last thing about points that's probably really helpful is that the way the map page works is that you can look at only one layer of data at a time, meaning that if I were to go from income to health data, the map will flip to those layers. So you're not overlaying those layer of data on the map. And that's really where the 3-layer maps comes into play. But in the case of points, you can add multiple point data sets on the map at the same time. So we can show hospital locations in relationships to retail-based retail care locations, which you guys don't have any. That's really odd. As well as other things like nursing facilities and so forth. So point locations, point data sets, you can overlay as many point data sets in the map at the same time. Data layers, which is the aggregate data, you can only look at one layer at a time on the maps page. The 3-layer maps is where you're going to overlay multiple layers of data. And we'll talk about that as we get further. Okay, so I covered a lot of stuff. We only have 22 minutes. I apologize. I get too excited to show you the new features of PolicyMap. But let's talk about 2 things that are really very unique within the tool, and I think that should really cover how do you want to use the tool. And that really is the 3-layer maps feature. So, you know what? In the case of 3-layer maps, it is one of the other things that we finished within PolicyMap. And so instead of just 3 layers, we call it multi-layers, and it works the same way, but you can actually now overlay up to 5 layers of data. And the way this feature works is that you're basically overlaying multiple layers of data, and you're going to cut the ranges up for each one of those layers, and the map will show you the intersection of those places, as well as the new feature, which is the overlap of those places. So I tell users using multi-maps or 3-layer maps, try to have a concept of data that you're trying to find places that would intersect with those data or how that data appears in the map. So we can do something simple and say we want to find places that have maybe a large population of uninsured population people. So we'll go to health insurance and then uninsured population. And so the way this works here is, it really hates me because it makes me zoom in. So one of the things you're going to see about the multi-maps is that the map can only render so much data at a time. So that's the reason why you get this message here, because eventually if you were to try to do a statewide map of census tracts, it'll break your browser. And that's the reason why we are forced using users down to a very specific zoom range before it breaks the browser in that process. But understand that the query that you do in 3-layer maps or multi-maps is being done for the entire state or the nation. So you can download that data or export that data at any time. But we'll stick with this concept for now. So initially, when you first add a layer of data in the multi-maps, it's like the maps page. The difference here, instead of showing you multiple colors and different range for each color, it's showing you one color, and that one color you get to determine by moving the range of the slider bar on the map. And as you can see, the histogram shows you the majority of the data is on this other side of this range, which is like below 10%. And as you move places, this is showing you that only places that have at least 9% of the persons here don't have health insurance in these particular census tracts. So no more than 9% in that process. And we can, again, edit the numbers and say, we can bring this up to 10% if we wanted to capture more places. So that's layer 1. And the next layer is adding another one to the top. So we can say we're going to add, let's say, we'll look at workforce that are under 30. It's always a struggle to find these millennials to see if they are covered in insurance or not. So with this, we'll do demographics, under 30. And then the next layer appears on top of the map. And from this, you can see the histogram of this value. We're still within the first range of at least 10% or no more than 10% of the persons don't have health insurance in here. But then we're showing the 100% of the workers under 30 in this range. And then the histogram shows you the majority of the data is within this place. So let's say we want to show no more than 20%. So what we get here are places that meet both criteria of no more than 10% of the persons don't have health insurance, but at least 20% of the workers here are under 30 in that process. And then we can add another one on top of this one. And let's say we do something simple like, are they medically underserved? So this is what we call a categorical data, meaning that there's no ranges to interact with. It's simply a stamped value itself. So in the case of medically underserved, it's either a medically underserved place or it's not. So in this case, we're going to say we just want to find places that are medically underserved. So now only places in purple are places that meet all three criteria of medically underserved, at least 20% of the workers here are under 30, and then no more than 10% of the persons here do not have health insurance. And that's kind of the basics of the three-layer maps. And this query that you see here is an AND function. So it's only places that meet exactly these three criteria, and that's the current version of PolicyMap. What we always learn from users is that they also want to see the overlap. How do these three layers compare to the entire community then, and just not the individual places that it matched against? So let's bring this number down so we can reduce this a little bit. And so with that, you have the overlap function, which is the OR feature. So now what we get are really, really messy maps sometimes, but it's actually a pretty beautiful map. So any place that are in blue are places that meet the first criteria, which is uninsured population. Any places that are on the left to right, this diagonal hash, are under 30, and then on the other hash is medically underserved. And so now we can see how these overlap instead of intersecting. So places that meet just the two criteria of under 30 and medically underserved are the hashed, and then of course the ones in between those ranges. So the OR function is something that users have always wanted with the three-layer maps or the multi-maps, and this really gives you this amazing ability to see not just the intersection of data, which is always helpful because it allows you to identify just these places that you're trying to address or work in, but then the overlap allows you to see the surrounding neighborhoods of how these places are matched up against those places.
So I'm curious, that's how we could really look at our health disparities. You didn't pull in a health outcome on that one, but I'm wondering if you could swap out one of the criteria to be a health outcome around, obesity or poor mental health days.
Yeah, so let's do that. So we'll stick with uninsured. That's always important. But then we can put in, let's say, chronic conditions.
And then I'm wondering if you could put in like a population, like a demographic.
Yeah, of course.
Like around race, maybe.
Yes. Let's say. So we'll do obesity from. So this is the OR feature. We'll stick with AND for now. And so again, majority of the data is within these very specific ranges. So these are places that meet just these two criteria. And then for this, we can say, we do a really cool one. Let's do predominant races, one of my favorite layers. I'm really going to jinx myself because it's also one of the most complicated ones. Let's see, we're in a minimum.
It is.
But in this case, let's deselect all. And we just want to show places that have maybe just African American. All right, see, I'm going to.
How about American Indian or Native Americans?
Yeah, let's do that because I think I'm really going to jinx myself with. All right, so this is all the way over here, unfortunately.
So there's none?
It's probably really low.
Because of our population size?
Yeah, see, you can see it's like less than 1% in some of these places. If we were to go probably further out to Indian areas, we probably would get that value.
No, I think I would defer to Elizabeth on this one. Go north.
On what specifically? Oh, where to go?
Yeah.
Do you want to try this in a different area? Yeah, go north to go. You could go north to the Flathead Res, or you could go east to like Northern Cheyenne or Crow.
What's a zip code I can plug it to?
59860 would be Polson.
I think that would be good because they probably, they're in our service area in some way.
So that's just like the zip code I know, but I actually think that's not the best zip code to go with. If you go just slightly south of there to Ronan, but yeah, did you see? Yeah, you see, like, choose an area like around Ronan, but I just don't know the zip code there. But that would probably be.
Look at that. There you go. So in this case, we need to change the uninsured population a little bit. This process. The other thing is, I know I'm breaking the beta right now because we're doing heavy data processing in the browser. So I apologize if it's not pulling up the data correctly. The only thing we're missing is the uninsured population because for some reason, yeah. But yeah, so this is what it's trying to do here is basically say that the diagonal lines, which we can change this to any other values, are places that have a very specific range of adults with obesity. So we can say at least 30%, and then this is no more than 20% of the uninsured population. And maybe it's maybe you're looking at the other range and you're trying to find areas that have a higher percentage of uninsured population. And then the last one is adults that are Native American. And again, this might be a thing where we bring this number up to 10%. Right. So this is places that meet all three criteria, and these are all actually greater than values. So this is at least 15% of the persons without health insurance, at least 30% of the adults were diagnosed with obesity, and at least 10% of the population is Native American or Indian. So these places meet all three criteria. This place just meets one criteria, and again, my browser is breaking this a little bit. But this is how you would be able to use the 3-layer maps in the multi-maps to show the intersection of this data.
Thank you. That's interesting. I'm curious, Haley, I know you've been working with this mapping system a lot. Do you have any questions about how this is working? Are you having mic issues too?
I think so.
Oh, can you hear me now?
Yes. Yep.
Okay. My question is on the I've done 5-layered mapping, and whenever I have like a race or a population, I can take that and go back and get data before 2018. But then whenever I do like a health outcome or a risk behavior, I can't get the data before the year 2018.
Yeah.
So I was curious if there's a way to do that.
Unfortunately, no, because the source of the health outcome data is only available for that 1 year. So the BERSIS data initially came out in 2014, and then they had an update in 2015, and then the CDC decided to ruin it and just do an estimate for 500 cities, and that was 2017 and 18, and then they just finally redid a national data for all the geography. So that's the reason why there's no comparative data sets for health outcomes, unfortunately, because there was too much inconsistency of the data that was published.
Interesting. I also have another question too. Whenever I go in and I do the 5-layered mapping, and I have, let's say, like the people who are the percent of people obese in Missoula County, and then the percent of people who are Native American and let's say that smoke. Is there a way to get the percent of, like, let's say Native Americans who smoke and are obese that live in Missoula County, or is it just the percent of Native Americans in Missoula County, the percent of people who smoke in Missoula County? Does that make sense?
Yeah, and that's a really specific query, and it would be amazing if the data could do that, but unfortunately, that's the data is only for those individual indicators, but there's no way to mash them together.
Alrighty, thank you.
Yeah, it's a good question. It's a lot of questions that users generally have about data. It's like they want to get just that health outcomes for very unique categories of race or incomes or demographics, but those two things don't talk together. Unfortunately, they're completely different sources. So the only thing you can do is see where they overlap, and that at least gets you the picture of places that have an X amount of demographics versus an X amount of health outcomes. But there's no way to put those two things together. Yeah, it's a good question.
Thank you.
That's really helpful. Would you have a sense of when you were talking about the Burfus data being 2014, then it was updated in 2015, and then they did the 500 cities aggregate data 2017-18. Do you know where it's going in the future?
So it's going back. So the 2018, and so if you click onto the source link for Burfus, this will take you to the entry, and then from this page is not the right page. So why is it? Oh wait, I think it's just my browser. Yeah. So this is where you can. So there is a 2019 update to it, and I believe that 2019 is back to the regular full coverage instead of the 500 cities.
Okay.
Yeah, 500 cities was just it was what we found was it's just there was lack of funding for the agency, and so they could only focus on a handful of places for that calculation.
All right, and I kind of have a little dream question for you. Census 2020 was captured during the year of COVID pandemic. When do you picture that data would be aggregated in the future? How many years does it take to upload that?
Well, that's a really tough one. So the ACS will be probably more updated, will be faster updated than the 2020 census. So generally the census takes about a year to process. I can only imagine the problems they're going to face with the margin of error with the lack of some of the surveys that might have occurred. So their methodology will be really challenged, I think, by other GIS aggregates. What the census does, I believe, because we do this for the ACS, is they do have panels that talk about, because we participate with the Burfus panel in particular, that talk about the methodologies, some of the challenges, and then people really discuss about margin of errors and how certain places affect. So long answer is that we'll have the census ACS data probably by the end of next year. So that'll have the 2015-2020 data, and then we'll have the decennial census probably by the beginning of 2022.
Okay, thank you.
Yeah.
Hey, this is Robin. I have to leave, unfortunately, in a couple minutes, but I have a couple questions for you. One is I think I understand correctly that Lisa can, because we're on a different subscription. I'm at the University of Montana Center for Children and Families, and but she could share the neighborhood data with me, or the neighborhood custom regions with me, it sounds like.
Yes.
Correct. Okay, cool. Just wanted to be sure. Lisa, I'll be talking to you. And then also, our group works a lot with tribes and such that are writing grants across the whole state.
Yeah.
And we're trying to figure out a way to like put custom regions on that. And of course, most of them are very rural areas. Do you have any ideas for me of where I can find reservation boundaries and how they match with, census error tracks or anything like that, so that I can try to draw those custom regions myself? I'm a little nervous about that, but
so we do have Indian areas from the census. Unfortunately, I don't know how the coverage is for that, but at the very least, we have the Indian areas, and you can make an assembled custom region based on Indian areas.
Okay, sounds good. Yeah. I'll take a look at that. So I was thinking I didn't have Indian areas for some reason on mine. Is that possible that I don't?
No, it's there. Unfortunately, it's just you have to scroll down to this darn bottom of this menu.
Okay, yeah. I felt like it was grayed out or something like that.
Oh,
I'll take a look.
it could be. So that's also because it's based on the zoom level. So if you're looking at the data at the national level, it'll be grayed out.
Oh,
But if you zoom in, you
okay.
can see some of these.
But if I go into the state level, will I be able to see it then from there?
Yeah, eventually it'll. Yeah, this is the state of Montana, and
Okay.
then you'll be able to see it. Yes.
Okay, cool. Great. That was my problem then. Yay.